Gentlemen, what if I told you that something as simple as ignoring a bathroom break could be slowly sabotaging your prostate health? Or that sitting in your favorite recliner for hours, reading or watching TV, could quietly be increasing your trips to the bathroom at night? If you're over 50 and you've noticed that familiar middle-of-the-night urge, the frustrating stop-start pee stream, or just that nagging feeling that something isn't quite right down there, you're not alone. But here's the kicker. It's not just aging. Your prostate might be sounding the alarm, and your daily habits could be pressing the wrong buttons. And the best part, you can change the trajectory starting today. So stay with me, because what I'm about to share could quite literally save you years of discomfort, embarrassment, and sleep disruption. Before we get into the 3 silent habits harming your prostate, let's quickly talk about why this matters so much. The prostate is a walnut-sized gland that sits just below the bladder. It wraps around the urethra, the tube that carries urine out of your body. As you age, the tissue tends to grow, but that growth doesn't happen in isolation. It's influenced by lifestyle, diet, inflammation, and circulation. When it gets inflamed or enlarged, it can squeeze the urethra, slowing your stream, increasing urgency, and making nighttime trips more frequent. But here's the crucial point. Just because prostate growth is common doesn't mean it's inevitable, and just because something is silent doesn't mean it's harmless. And here's something most men never hear from their doctors. Your prostate reacts to your environment. It listens to your stress levels, your hydration, your food, and your activity, or lack of it. Just like your heart responds to cholesterol or your liver to alcohol, your prostate responds to pressure, both physical and internal. So if you've ever felt like these issues are out of your hands, they're not. The truth is, many prostate problems aren't random. They're the result of patterns. And that's good news, because patterns can be changed. That's why today we're not talking about medicine, surgery, or supplements. We're talking about awareness and 3 everyday behaviors that most men overlook. How many times have you told yourself, I'll just finish this errand first? I don't want to use the public restroom. I'll go when I get home. Sound familiar? That simple delay, done over and over, starts creating a dangerous pattern. Here's what's happening inside. When you hold your urine, your bladder expands like a balloon. But it doesn't just stretch upward, it expands downward too, right into your prostate. And the prostate, already sensitive and aging, doesn't take kindly to being constantly compressed. Imagine sitting on a sponge over and over, day after day. That pressure makes the tissue inflamed, rigid, and over time, less functional. Studies show that prolonged urinary retention increases post-void residual volume and contributes to bladder outlet obstruction, where your bladder can't empty fully because the pathway is narrowed. When you feel the urge, go. Don't wait. Train your body to respond early rather than waiting until it's urgent. Keep a hydration log for a few days to track frequency and flow. This one small shift can help your bladder and prostate work in harmony, not opposition. You might not think your bowels have anything to do with your prostate, but they're practically roommates. When your colon is backed up, especially with hard, compacted stool, it places pressure right on the backside of the prostate. Imagine a brick pressing on a balloon, constant pressure, all day. That tension cuts off circulation, irritates nerves, and promotes chronic inflammation. Chronic constipation has been linked to elevated cytokine levels in the pelvic region, which correlates with prostatic inflammation and even urinary retention symptoms. But it gets deeper. When stool stays in the body too long, it throws off your gut microbiome, your internal bacteria balance. That imbalance causes systemic inflammation, which affects not just your immune system, but your prostate, heart, and even brain. Start your day with a fiber-rich breakfast, oats plus chia plus berries. Increase hydration. Your colon needs water to move waste. Add 1 to 2 tablespoons of ground flaxseed daily. It's gentle but powerful. Consider a magnesium supplement if you're often dry or slow to go. Consult your doctor first. This isn't just about going number 2 more easily. It's about removing the hidden pressure that's been slowly wearing down your prostate for years. You may love your recliner, or your office chair, or even just a good long book on a Sunday. But here's the cold truth. Stillness stagnates. Your pelvic region needs movement, subtle, regular motion, to keep blood and lymph flowing. When you sit for hours, your circulation slows. Nutrients don't get delivered. Waste doesn't get carried out. And your prostate? It sits there in a low oxygen swamp of stagnation. Medical literature now links sedentary lifestyles to increased risk of lower urinary tract symptoms, LUTs, and benign prostatic hyperplasia, BPH, progression. You may not feel anything today, but over months or years the inflammation builds, and suddenly you're waking up 3 times a night and wondering, what happened? You don't need a gym. You need motion snacks, little breaks that keep your pelvic tissue alive, soft, and responsive. You might be thinking, come on, it's just pee. It's just part of aging. But the truth is, aging is natural. Discomfort is not. You don't have to accept poor flow, urgency, or nightly interruptions as your new normal. I've worked with hundreds of men who changed the game, not with pills, but with awareness. And listen, this is not about perfection, it's about progress. If you do one thing this week, let it be this. Choose just one of these 3 habits to change. Start with the easiest one. Stick to it for 7 days, then build from there. Your prostate, your sleep, and your comfort are worth the effort. You might have thought those nightly bathroom trips or weak urine flow were just a normal part of getting older, but now you know better. These symptoms are your body's way of asking for help, and you can help it. Small daily changes, going when you feel the urge, eating more fiber, moving your body every hour, can make a huge difference in your prostate health and your quality of life. So if this video helped you even a little, do this. Hit the like button. It tells YouTube this content matters and helps more men find it. Subscribe if you want more no-nonsense, science-backed advice to stay strong, healthy, and in control after 50. And drop a comment below, whether it's a question, a personal story, or just a thank you. I read everyone. You're not alone, you're not powerless, and you're not past your prime. You're just getting started. Take care of your health, and it will take care of you. See you in the next video where your strength and wellness come first.